So I think the first thing for me to say is that it's definitely an area that we recognize that more work needs to happen. Ensuring that we not only prevent, but we eliminate mother-to-child transmission of HIV. I think the very best part of it is that the science is there, the knowledge is there, the capacity is there in country. But the sad bit is we have not done as well as we ought to have done over the years. But it's changing. It's changing because we've recognized and understood what we need to do different. And that's what we're doing now. So let me just start by laying a background that last year the Honorable Minister of Health, Dr. Osagie Ehanire, convened a national dialogue. The purpose of that dialogue was to have a broad stakeholder engagement to understand what the issues were. Now that led us to have a 6-year analysis, a deep dive analysis of what the problems are. Through that analysis, we looked across all the 36 states and the FCT, looking at existing data and trying to understand and ask some critical questions. Most important is, why are women not accessing testing? Because that's the entry point. You cannot put a woman on treatment, which is about now preventing transmission to her unborn baby or her baby who's already born. So the first thing is identifying. So why were women not testing? And one of the critical things we understood is the fact that in Nigeria, less than 50% of the women actually deliver in facilities. And a lot of our focus of our work has targeted facilities. And so if a woman is not coming to the facility, then you're likely to miss her. And what have we done based on that understanding? What we have done is now to say that we have to expand community PMTCT. That's one and very important. So we're saying, regardless of where a woman chooses to go to deliver, we should find them, test them, and link them. Now, based on the current data that we have, we know that most people who are tested positive, up to 86% of the women who test positive, actually get into the program. So the problem is not about the treatment part. That's not the biggest problem. The biggest problem is that we have only 46% of them who actually test and know their status. So a lot of our effort is going to be focused on finding the women, wherever they are, whether they are in the facilities, whether it is a tertiary, secondary, primary facility, whether it is in the community, whether it is in the private sector, whether she is at home delivering, because we cannot run away from the fact that many women deliver at home for various reasons. So that is the current thrust. And in order to identify all of those locations, starting from next week, we're starting a mapping process. That mapping is going to take us out into the communities. It's going to help us to identify and ensure that those locations are visible to the formal health system, right? To do two things. One, to be able to increase the coverage from a service perspective, and also to capture the data and account for all the services that are being delivered. Against this background, I just want to say that we're very fortunate. We have wide stakeholder engagement on this. Our partners are supportive, and we're all on the same page as to what to do, and hands are coming together to ensure that what needs to be done is done. Our target now: eliminate mother-to-child transmission of HIV and ensure that no woman and no child is left behind. Thank you. Dr. Kudo Ibazu. I don't, but I'm the national coordinator of the National AIDS and STI Control Program in the Ministry of Health.